You to this meeting. I'm Malika. I'm the Senior Director for Health Equity Partnerships and Programs at the Association of American Medical Colleges. I'm delighted to be here at this meeting because I'm enjoying being around my colleagues and leaders in the field that are talking about diversity and inclusion and equity. But oftentimes we come to these meetings and we're inspired. We hear about the startling health disparities in our nation, and we vow to do something even more than we've already been doing in our career. We meet colleagues that challenge us, and we leave here wanting to partner with them and think about ways we can make even more of a difference in our local community. We may even hear about a new job opportunity here. But one thing I hope that we all do in the next hour is to leave this meeting with a plan for the future. The National Minority Equality Forum is looking to you in this room, to those of you who have the ideas of how to advance health in our nation, how to reduce health disparities, how to advance health equity, how to make sure that we have the workforce that is diverse and inclusive. So we're going to put you to work. Over the next 30 minutes, you're going to be working with leaders across our nation to talk about 4 different areas. Healthcare workforce. How do we get diverse members of our community into the health professions? We're going to talk about research and development. How do we make sure that the research that is done in our communities applies that equity lens to make sure that we can reduce health disparities? How do we make sure that we are delivering the clinical care that is going to improve health disparities, applying that population health perspective, making sure our nation has exactly what it needs in terms of the clinical care it receives? And I think this is one of my favorites. How do we really engage with our local community? How is it a partnership? Not just the service that we provide or the outreach that we provide, but how are we really engaged? So I'd like to introduce my colleagues. You all have a choice, 30 minutes to meet with, and we'll start with Dr. Cleo Samuel. She's a professor and health services researcher at UNC, and she'll be leading the discussion on research and development. So my front right, she'll be leading that discussion. You can go talk to her. My colleague, Dr. Eja Endum, is a neurosurgeon at NIH. He does research around brain tumor immunology, and he will be leading the discussion around clinical care. So please join him. Dr. Donney John, he's a pharmacist and leads a nonprofit in the area to give life-saving medications to those in underserved communities. And Dr. Alden Landry, who is a professor at Harvard in emergency medicine and also Associate Dean of Diversity and Inclusion. He'll be leading the discussion around having a diverse and inclusive workforce. So what is your charge? You have 30 minutes that will be facilitated by my colleagues, to give NMQF one idea, one big idea that they can provide they can work on over the next year and report back. Something that can transform our nation, but that's actionable, that's doable in 1 year. They won't do it by themselves. They'll be calling on you, they'll be calling on all of us to work with them. But this is our time to make a difference, and I will let you all go. You have 30 minutes, and we'll be reporting back right at the end. Thank you.
Undergraduate students to this environment and let them meet us, let them engage, let them learn about policy, the nuts and bolts of the conversations that we're having, but then also using this as a chance for them to identify mentors, and also using this as an opportunity to potentially identify internships from many of our wonderful sponsoring organizations that we're scrolling across the back. And so as we continued this discussion, we talked about how else we can engage students and making sure that they have an understanding of the policy, having the mentorship, having the internship opportunities. And then also, I lost my notes, so you all have to, oh, here they are. The last one is leveraging our affinity groups and sponsors to come on board to some sort of pledge around workforce diversity. And that's the other component that we talked about. So I think that's a group. Did I get it right?
Sounds like a great discussion. So question for you. I hear that you want to bring youth to this meeting as well as engage them on social media. Was there any discussion about taking advantage of the location of the meeting and bringing local youth or how do you bring youth from across the country?
And we did talk about that. We talked about the community colleges here in the area. We talked about the undergraduate institutions in the area and recruiting from them to get them to come. That's going to be the easiest source. But then also with our sponsors and with the affinity groups, could they provide scholarships for individuals to come and participate in this forum as well?
Great, thank you. So Dr. Shea is an internal medicine resident at Christiana, and so he will be presenting on behalf of the research and the clinical care group. Sorry.
Thank you. We were charged with giving NMQF a one-year mission or task towards decreasing or increasing equity in the clinical care sphere. And our title really was Speaking Truth to Power, using data to eliminate disparities in clinical care. Because really the one word that was throughout our group was data. And that's one word we've also heard really over the last 2 wonderful days of discussion. And we came up with recommending NMQF to really have a primary or / directive to guide healthcare organizations ranging from single provider clinics all the way up to industry or healthcare organizations to do either data collection or quality improvement. And we organized it into really 3 areas of interest. One was towards patients, because patients are very, very interested in trust, security, and transparency, and what kind of data is being collected, how it's being used, and how secure is it once people who are using data get it. 2, it will be under health providers. And we want to really include not just your traditional health providers like physicians, but also pharmacists, nurses, medical assistants, pharmacy technicians, many people that all serve to help our patients. And under that, it would be towards value-based care, RVU's efficiency, and evidence-based outcomes. And then finally, to charge NMQF also to build this primer towards healthcare organizations in cost analysis and interoperability, which was a huge word in one of the earlier sessions.
So thank you for that. So many times I hear conversations around population health and quality improvement, and equity is left out of the discussion. And one of the main reasons is a lack of data or difficulty around getting these data. Did your group have any ideas around how do you either standardize or ensure that data is available so that you can apply that equity lens that you talk about?
One of the big things we were discussing was how do we define data? And definitions is a great place, I think, for all these interest patients, health providers and healthcare organizations really come down and sit together and talk about that. Because, for example, the issues of gender and sexual orientation may be very different from the academic setting to the providers to how a patient themselves define themselves. And we won't know what we don't know. So I think it's also very important to look at how that data is collected and by whom, so we can ensure that it's done with the most respect to the people that it really matters the most to, which is finally our patients.
So a round of applause for the clinical care group. Dr. John, would you like to talk about community engagement?
Yeah, so the group back there, shout out to that group. We came up with a bumper sticker and a t-shirt idea, and we have to give all royalties go to Nestor. So for community engagement, one of the things that we focused upon was immunizations, because it's such a hot button topic right now, where we have more measles outbreaks this year alone than all of last year. And just today, Mayor de Blasio in New York issued an alert about vaccinations. And the bumper sticker and the t-shirt idea was something that Nestor had mentioned of this radio station that we should all listen to, WIIFM, what is in it for me? That is a radio station that almost everybody listens to, and we need to figure out how do we create that value proposition to get people to change, and that starts with messaging. So our biggest thing for NMQF is to look at tactics and techniques. And the ways that we've highlighted some tactics and techniques to evaluate are the role of community health workers, promotoras, and school nurses. How do we leverage trusted community resources to get the folks in the community engaged? Because people will trust people that they know that are within the community. So we need to figure out what type of programs work, how do we elevate those type of programs and scale them to other communities. In conjunction with that, we looked at social media. Going back to the radio station, WIIFM, we need to figure out how to get the message so that our message of reason is louder than the message of chaos. So part of it is looking at social media influencers. How do we get them to kind of spread messages that are more concrete with evidence-based, so that way we're not always arguing facts. People like to choose who they want to believe. So people will tell you, I saw Dr. Oz. Dr. Oz told me this, or the doctor show told me this. And then you say, well, that's not sound medical advice. Let's look at the real story. But people are going to follow what they see as the influencers doing. The Tide Pod Challenge is an example. Who would be dumb enough to go and eat a Tide Pod and think it was cool? But that's what college students and high school kids were doing all across the country, where Tide had to redesign their package, which they made look like a wine box. If you've ever had boxed wine, that's what the Tide's new labeling looks like. And so along with social media influencers, kind of highlight, we live in a world where we don't know the tragedy and the traumatic experience of having polio or certain illnesses that have been eradicated. So we need to kind of bring that back to the forefront of showing what's the risk of not getting vaccinated. And we need to have more visuals so that we can educate people about, yes, there are side effects and potential risks, but the harm for not getting vaccinated is even greater. When the governor of Kentucky admits that he had chickenpox parties to get his kids exposed to chickenpox, that's an elected official. And as Dr. Christensen had mentioned, politicians don't look at facts, science-based research. They look at counting the votes and who's going to keep them in office. So we do have to be louder than the anti-vacciners. The other thing that we talked about was, NMQF does a great job of doing resource mapping, like heat mapping and health mapping. But let's figure out how we can do a resource mapping of highlighting what are successful programs around the country that focus on engagement and kind of create a way for all of us to access those resources. And one of the resources that I highlighted to the group was called the Community Toolbox from the University of Kansas. It is an excellent tool. It's free. We love free. So being a nonprofit, you have to know what's free. And so Community Health Toolbox from the University of Kansas is an excellent resource that's open for anyone to use that really goes through the step-by-step process around different community topics, especially if you have to get grants to fund your line of work. That is a resource that I, as a nonprofit executive director, use a lot to kind of justify my grant applications. But those are our biggest things, tactics and techniques. Get everybody tuned into the WIIFM. Get all royalties to go to Nestor. He likes a lifetime perpetuity of contract. He's licensing it. And having a resource map from NMQF that really highlights all the toolboxes, because there are so many great toolboxes out there in kits, but it's hard for us to go to 5 different websites. If there is one place where we can find all that information and we can help leverage that, that would be extremely beneficial for us for next year.
That sounds like a very detailed conversation. I think that was wonderful. So you mentioned what's in it for me. Was there any discussion around the business case for this work for large institutions, especially when you talk about investing in community health workers?
So one of the things that we talked about was the value of group visits. And that directly ties into reimbursements, where group visits do work, but you have to get reimbursed for group visits. And looking at, AMA started the ICD-10 codes with the United Healthcare Group for social determinants of health. We need to work on getting reimbursed for group visits. If you can make a group visit more profitable than seeing individual patients, you'll probably see the outcomes. And that's part of studying the business case of, can we get more group visits approved, so that way it's not taken away from the physician time, but it's giving them time to work with a collaborative interprofessional team, so you're leveraging nurses, pharmacists, and other allied health workers more effectively.
A round of applause for our community engagement group.
Great job, guys.
And last but not least, Dr. Samuel and our research and development.
Yes, so I would like to thank all of the participants of Team R&D. So we had a lively discussion, a great discussion, but what we distilled it down to was that what we really felt needed to be a priority in the coming year is increasing the representation of racially and ethnically diverse communities in research. This has been a topic that's been a discussion throughout this summit, and so we decided that we wanted to narrow in on that. And specifically what we decided was that we wanted to encourage NMQF to work towards developing a toolkit that would highlight best practices for enhancing diversity in participant recruitment. And so we have we'd say was a three-pronged strategy to accomplish this end. The first element involves data gathering. So this includes doing a landscape review to identify the key barriers to participation, in research studies and clinical trials, so identifying the barriers for communities of color. As part of this, we'd also identify hotspot communities, areas that we could potentially target that have diverse populations that have been traditionally underrepresented in clinical trials. Additionally, working towards identifying what are some of the best practices that exist already. We know that there are some groups, some entities that have done pretty well in terms of recruiting diverse populations into research trials. And so identifying what those best practices are would be helpful. And then lastly, as part of data gathering, identifying organizations for whom we could disseminate this toolkit that we would develop. The next phase would involve actually developing the toolkit. And one thing that we really highlighted or wanted to emphasize was some type of including a training that could be provided to clinical researchers, medical staff, and the teams that are actually engaged in recruitment of diverse populations into these studies. And then finally, after we develop this toolkit, the next phase would be dissemination. And so this would all culminate with a panel that we would hope to have present or represented next year at the next NMQF Summit. And this panel would feature a patient, community leader, and clinician, as well as a sponsor, who can really talk through what they have done to successfully recruit diverse populations into their clinical trials. So really hearing from boots on the ground the strategies, what they've done to actually make this a reality. And then the idea would be that after this session, we would then distribute or disseminate a one-pager that kind of summarizes the key components of this toolkit that, again, could then be disseminated to those organizations that we identified previously that would be good candidates for sharing these best practices and information. So that's our strategy.
So show of hands in the room, who would want to attend some of these trainings that Dr. Samuel mentioned? All right, the Brandons, I think you have your work cut out for you. So thank you all for participating in this really in-depth part of the meeting. So many times we can come to a meeting and be inspired and learn a lot, but not oftentimes we actually feel like we're a part of something. So when we come back next year, we hope to see some of these action items that you've heard on stage, and I hope that we all get involved and help NMQF in the year to come. Thank you to my presenters on stage and the facilitators, and I'll turn it now over to the Brandons.